Assalamualaikum and a very good morning. This is my orthodontic case presentation. Part A. Patient's details. Patient with initial of NSMF with the age of 24, female, came with the complaint of crooked teeth. Patient is medically fit and healthy. This is extraoral photos of the patient. Based on skeletal assessment, anterior-posteriorly, patient present with class 2 skeletal pattern with convex facial profile. On vertical assessment, there is moderate Frankfurt mandibular plane angle with reduced lower anterior facial height. Transversely, patient has grossly symmetrical face with competent lip at rest. This is intraoral photos of the patient. From intraoral examination, patient has good oral hygiene with minimal plaque visible, with normal oral mucosa, with pink gingiva with sharp interdental papilla. Teeth present, all teeth are present except for all 8. On the lower arch, it is square shape with crowding of 8 mm. On the labial segment, 3-1 is distolabially rotated, 4-1 is mesiolingually rotated, 4-3 is mesiolabially rotated. On the buccal segment, right side is well aligned, while for the left side, 3-4 is displaced lingually with 2 mm displacement of contact point. On the upper arch, it is U-shaped. For the labial segment, there is moderate crowding of 4 mm. 1-1 and 2-1 are retroclined. 1-2 are mesiolabially rotated. 2-2 is mesiolabially rotated. 1-3 and 2-3 are distolabially rotated. For the buccal segment, 1-5 is distopalatally rotated. 2-5 is displaced palatally. And there is 2 mm contact point displacement between 2-5 and 2-6. For labial segment relationship, patient has class 2 division 2 incisor relationship with increased overbite of 50% and reduced overjet of 1 mm and lower midline shift 2 mm to the left. Buccal segment relationship, for right canine and molar relationship, it is class 1, and for left canine relationship, it is class 2 half unit, and for left molar relationship, it is class 3 quarter unit, and there is presence of posterior scissor bite of 2-4 to 3-4. Radiographic assessment, this is an orthophantomogram. All teeth are present and there is no pathological radiolucency or radioopacity detected, and as you can see, the 3-5 is tilted mesially. This is cephalometric analysis. Based on the result, we can see SNA is slightly increased, which conclude prognatic maxilla. SNB is within the normal range, which conclude normal mandible. And A and B is slightly increased, which shows skeletal class 2. And SNMXP is within the normal range. So this proves that Eastman correction can be done. MMPA is reduced, so which shows the inclination of the maxilla in relation to the mandible is reduced. UIMXP is increased, and LIMNP is also increased. LIA is within the normal range, which shows normal interincisor angle, and lower anterior facial height percentage is reduced, which shows reduced anterior facial height. So the IOTN is 3D. There is total displacement of 4 mm of upper and lower arch. Summary, patient is 24-year-old Malay female with a chief complaint of crooked teeth. She was presented with class 2 division 2 incisor relationship on a class 2 skeletal base with moderate Frankfurt mandibular plane angle with low lower anterior facial height. There is crowding of upper labial segment of 4 mm and moderate crowding of 8 mm on the lower arch. She has scissor bite on 2-4 to 3-4. She has reduced overjet of 1 mm and increased overbite of 50%. The right canine and molar relationship are class 1, while for the left canine relationship, it is class 2 half unit and left molar relationship is class 3 quarter unit respectively. For the problem list, first, class 2 skeletal pattern. Class 2 incisor relationship, reduce overjet of 1 mm, increase overbite of 50%, crowding on the upper and lower arch, scissor bite of 24 to 34, Class 2 half unit left canine relationship, Class 3 quarter unit left molar relationship. For the aim of the treatment is to accept the skeletal pattern, to correct the incisor relationship to class 1, to increase the overjet, to reduce the overbite, to relieve crowding on upper and lower arch, to correct the scissor bite, to correct the canine and molar relationship to class 1. For the etiology is skeletal pattern and tooth arch size discrepancy. For the treatment plan, is to give oral hygiene instruction and oral hygiene education, full mouth scaling and prophylaxis, upper and lower fixed appliance, then upper and lower retainers after completion of fixed treatment. Part B. With the case scenario of a 60-year-old Malay lady came with a complaint of jutting out of her upper and lower teeth. There are spacing presented at the upper and lower labial segment. Please design an appliance to close all the spacing. So these are the intraoral photos of the patient. So for the upper arch, I plan to put Adam class on 1.6 and 2.6 for the retentive purpose and labial bow from 1.3 to 2.3 to retract the procline anterior teeth into correct alignment, and also acrylic base plate with posterior bite plane, which is to disengage the posterior occlusion to increase the overbite. For the lower removable appliance, I plan to put Adam class on, there's typo, Adam class on 3, 6 and 4.6 for retentive purpose, and labial bow from 3.3 to 4.3 to retract the procline anterior teeth into correct alignment, and also acrylic base plate as a support to all the component also act as encourage. Thank you.